Good morning. My name is Fatah Makran. I am a second year BPT student. I am going to explain you the stretching of hamstring. Let us begin. What is stretching? Core definition. Stretching is a physical practice in which the soft tissues, like including muscles, tendons, fascia, and other neural structures, are lengthened to improve the joint motion or movement. The primary goal of stretching is to improve the joint range of motion, which is occurred by increasing the extensibility of the muscular tendinous unit, and it affects the whole system and not just the muscle fibers. Then, what are the benefits of the stretching? A well-designed stretching program improves flexibility, mobility, and recovery. The benefit depends on the intensity and the consistency of the stretch. Improved flexibility, stamina, and strength. The strength, stamina, and flexibility is increased, obviously. Then reduce muscle soreness and pain. If the muscle is under the spasm and causes the pain or under the soreness, so it will reduce it. Enhance flexibility with static or PNF. PNF is proprioceptive neuromuscular facilitation, and PNF stretching or static stretching improves the flexibility. Improve joint mobility and movement efficiency. Joint mobility will improve as the extensibility of the soft tissue is increased, and movement will be efficient. Further benefits of the stretching. First, greater force to the full range of motion can produce a wider range of motion. Then lower back problem prevention. As the regular hamstring stretch is given, then it may reduce the stress on the lower back. Better posture and body alignment. Flexibility will improve and support the better posture and movement mechanics. Better warm up and cool down. Before exercises and after exercises, the stretching is implemented, so it will be more beneficial. Improved appearance and self improvement. Better flexibility and posture can be improved, and body image can also be improved. Indications of the stretching. Stretching is indicated when the soft tissue has lost its extensibility, or the prevention is the goal. And it is used to reduce the disability, then increase the mobility and support the joint health. First is loss of extensibility. If the soft tissue has undergone the contractures or any adhesion formation or any scar tissue formation is there, then to increase the mobility, stretching can be applied. Second is the risk of deformity. If the early stretching can help prevent the progressive joint soft tissue shortening and structural deformity. Weakness of the tight opposing tissues. If the hamstrings are tight, then it might be the chances that the quadriceps might be weak. This can be prevented by applying the stretching. Fitness and injury prevention. It can be included in the total fitness program to maintain the tissue length and mobility. Before and after the exercise, warm up and cool down for that purpose. Contraindication of stretching. Stretching is contraindicated in many clinical situations and may cause the harm. Before applying any stretching protocol, assessment is must. And in case of any doubt, consult a healthcare professional. First is bony block. In bony block, stretching is contraindicated, and it may worsen the condition if it is applied. Recent fracture, improper bony union is there, so stretching should be not given. Acute inflammation or infection, as in acute stages, we avoid giving stretching. Sharp and acute pain. If the pain is very sharp and acute, the patient won't allow you to even touch them. Hematoma or tissue trauma. Active injury is there, stretching may worsen the condition. Hypermobility, if the joint is already hypermobile, stretching cannot be given. Compensatory soft tissue stability. Stretching may remove needed joint stability. Needed joint stability is removed by applying stretching, so it is contraindicated. Then functional dependence on the shortening. If the shortened tissue support the functions in case of weakness or paralysis, avoid giving stretching to that case also.
Before we start with the stretching of the hamstring, we'll go for assessing the hamstring muscle or testing the hamstring muscle, tightness of the hamstring. So we'll ask the patient to go in the supine, and we'll ask the patient to go for the hip and knee 90 degree flexion. Then we'll ask the patient to, this other limb would be for the reference, and the other limb will ask the patient to lift. And if the patient is able to go beyond 45 degrees and to 90 degrees, then the patient will have the test which is negative. If the patient is not able to do the full 45 degree, up to 45 degree, then the patient is having the hamstring tightness. So now we will start for the stretching of hamstring. The first position is where the patient is in the supine line, and we'll take the patient's one leg over the shoulder, and then we'll support or stabilize over the knee so that the knee doesn't go into the flexion, and then we'll give the stretch. We are feeling the stretch. We'll hold it for 30 seconds and then we'll release it. This is the first position for the stretching of hamstring. Now second position of the stretching of hamstring. So the alternate position for the stretching of hamstring is the supine with the therapist on the knees, and the kneeling position locking the other limb, and this limb would be on the shoulder, and stabilize the knee so that it doesn't go into the flexion, and then apply the stretch for 30 seconds. You feel the stretch, and then release it. So to stretch the lower end of the hamstring, the patient would be in the prone position, and then we'll apply the stretch in the downward direction like this. Don't allow it to push. And then relax. So we'll get the new range. And now the self-professional. So for the self-stretching of hamstring, we'll put the leg on the stool, and then we'll try to touch the knee, and where we will feel the stretch over the hamstring.